Hi there. Hope you enjoy the break. Actually, today I will talk about neurodegenerative disease. And to be specific, I will actually focus on the rare disease, okay? Which means that it affects less than 1 in 1,000 people in the world. So the bad news is because these diseases are so rare, so they don't receive the attention that they deserve. However, 2 years ago, there's an ice bucket challenge. Yeah, I think some of you might have joined that before. Well, I'm not sure how many of you actually familiar with the disease behind the ice bucket challenge. Actually, it is ALS, which is a form of neurodegenerative disease. So let's think of this for a second. So even though that the population of these neurodisease patients is so small, is it just to allocate so few resources to them? Well, what could we do to improve their diagnosis? Well, perhaps we can group them together in a collective way. So if we look at all the rare diseases, there are over 6,000 of them. And they collectively affect about 1 in 20 people around the world. So what if we can design a platform that can diagnose all these diseases together in a fast and effective way? So could that improve the outcome for these patients? So that's actually what we are aiming to do. So the key enabler for such platform would be the sequencing technology. So in about 10 years ago, in 2003, the announcement of the human genome was after 15 years of work, the first human genome was drafted in 2003. Since then, the sequencing platform has improved so tremendously over the years. It actually surpassed the Moore's law, which is a law in computer science, which says that about in 2 years of time, the cost of computing would decrease about half. And actually, the sequencing cost decreased much further than that. So effectively, basically, from microorganisms, and if we move up the tree of life, basically every species and most species in the tree of life in this diagram were sequenced before, like monkeys, chimpanzees, chicken, fish, and you name it. So that's why we have to take the wave of this sequencing revolution here. And the key enabler of such technological revolution is the development of Illumina sequencing machine. Like the machine here is a latest model, which is called HiSeq X10. It can sequence 1.x terabytes of data in just 2 weeks' time. To put you into perspective, this machine can sequence 10 human genomes in high resolution with just 2 weeks of time. So when you look at the diagram on your right-hand side, it's actually an image of 1 single reaction, and each tiny dot represents 1 single sequencing reaction. And there are millions of dots within a single chip. So that's why it's so massively parallel to sequence all the DNA in such a small chip, okay? But here comes the challenges. Because there is so much data coming from this machine, here comes the big data and analytic challenge. How can we effectively store all this data? How can we pick up a single mutation from such a large amount of data? And how can we associate the genetic data with phenotypic data, the clinical data, and to infer the disease behind the genetic information? That's what we do. As a computation scientist, we try to figure out what the disease is behind this kind of data. So that's why we have developed the Genesis screening platform. We focus on the 312 neurodisorder-related genes in the first instance because they are more likely to happen in the Hong Kong population. And altogether, they cover spinocerebellar ataxia, which was covered by Maggie's talk. We also cover spastic gait ataxia, We also cover dementia, Alzheimer's, Parkinson's disease, which is a memory-related disease. And altogether, there are about 200 new disorders covered in this platform. And we aim to decipher and prioritize the diagnosis based on the genetics information and also the observations from clinicians. So how do we actually refine the diagnosis from the clinicians? Well, usually doctors would just use some fake terms like the patient cannot walk properly or they have some memory problems, and that is not helpful to pinpoint the exact disease or the exact diagnosis. So what we can do is that we combine that with the disease markers in our database, and also from the sequencing machine, we can learn about the mutations behind each patient. And we run some association, and also we have our own pathway databases such that we can refine the diagnosis. For example, in the first case, the doctor says that there's a case with putative cerebellar atrophy. And as we learned that there are more than 40-something subtypes of cerebellar atrophy. From our data, we actually learned that there's a marker PRKCG, histidine 101 tyrosine mutation, which points to the SCA14 subtype. And there are many more cases in this diagram here. Like in some cases, the patient was suspected to have Alzheimer's disease, but actually he has SCA35. So in some cases, some of these diseases actually has a curable treatment. Like in some cases, doctors think that the patient has SCA, but actually it is related to some kind of copper metabolism disease, which is curable with some drugs. So behind the scenes, actually there are more elements in this platform. Like we have our own computational cluster. We have about 128 CPU cores with 512 gigs of memory to decipher all these, to crunch all these big data. And then we also have our own standardized human phenotype ontology platform, such that doctor can enter the clinical observations in a standard way. And then we also curate the pathway databases. We also curate the variation frequency among major ethnicity around the world. So altogether, using so many features, we can pinpoint the disease markers and also the diagnosis of the patients in an accurate way. So we are still developing this platform. We are working on integrating even more features from these patients. We have accumulated about 200 patients at the moment, and we are planning to expand this platform to other adult neurodegenerative diseases. So the whole platform actually is supported by the Division of Neurology in Prince of Wales Hospital in Hong Kong, and also from the School of Life Sciences in the Chinese University of Hong Kong. And that's the end of the presentation. So I'm free to ask me any questions.